Hello, my name is H.L. Christensen. I'm a member of the CCW Safe investigative team. We provide investigative services should any of our members be involved in a shooting incident. I wanted to talk to you today a little bit about caliber versus shot placement as far as the weapon you carry every day and the considerations of some of the things you might consider when you're picking out your everyday carry weapon. One of the common misconceptions is that you want to carry the largest caliber possible for the situation. I think far more important than that being a selection criteria, the important focus is to look at your comfort level, your familiarity, and your proficiency with your everyday carry weapon. Certainly investigated lots of shootings where we have seen a large caliber weapon that did not result in the stopping power wanted because that shooter was not proficient in using that weapon. Controllability, being able to produce accurate results with every shot is far more important than the large, slow-moving caliber that you're wanting to select. Was involved in a lot of investigations for shootings where the 9mm with accurate shot placement was just as effective as a .45 ACP in the hands of a right shooter. So your ability to effectively control whatever caliber you've selected is far more important than what you consider the lethality on paper or the stopping power on paper of that particular cartridge. In addition to that, I kind of wanted to talk about the gunshot wounds in of itself. My experience is in the realm of forensic death investigations at the state level, and we saw a number of different types of gunshot wounds, a number of types of different fatal shootings that were atypical from what you see presented in the media, what the normal person sees on TV. I saw plenty of fatal gunshot wounds, near fatal gunshot wounds that were strikes to the thighs, to the shoulder, to the lower abdomen. Obviously the focus in practicing with your chosen caliber is going to be proficiency and getting control of that round rather than just trying to go with the largest possible caliber. Wanted to talk a little bit also about the gunshot wound of itself. There's several different considerations in a gunshot wound as far as the area that you're hit in the body. The biggest consideration is going to be what is the vascular structure of that area, what is the type of vital organ that's being damaged or struck in that instance. We talked about gunshot wounds, entrance wounds in the thighs. There's a tremendous amount of vascular structure in the upper part of the leg, the femoral artery, tremendous amount of blood flow that's going to occur as a strike to center mass, oftentimes not as effective as that sort of strike as well. In addition to that, I wanted to talk about the importance of types of ammunition in your everyday carry weapon. We all know that your typical soft nose or military ball ammunition in a, say, 115 grain, 125 grain 9mm round is designed for penetration and to carry on, and that's, you know, the old school approach to ballistics, whereas what we see in a gunshot wound with a hollow point round or an advanced type of ammunition is that it delivers the kinetic energy to the area of the body you intended to strike and then does not continue on. There's a great misconception in the media and the things that you see on TV that a bullet strike from a large caliber weapon or even a shotgun is going to propel a person backwards, take them off their feet, things of this nature. There's absolutely no demonstrative evidence in which the kinetic energy of a forward-moving projectile can overcome the forward movement of a body. So what we see is stumble. We see strikes to the head, strikes to the appendages, where an individual or attacker is still stumbling towards you, where you're not sure if you're out of danger yet. So taking into consideration where your shot placement, taking that into consideration is obviously, as we've stated, far more important than the caliber or load that you're carrying. As far as what is the more lethal approach, what provides your stopping power to that situation, I think that you know, the way most shooters are trained is for that double tap, that control pairs approach, where you're firing multiple times. That second shot is a follow-up to your first. In shooting instances that I've been around, there's really not this focus on a sight picture and trying to, as we train at the range, we're not trying to realign that sight picture after the first shot. It's just providing the ability to produce those control pairs, those double taps that put the rounds downrange to end whatever situation you're in.